thank you for joining us. And just again, to clarify, there was an error in the program, possibly due to some communication. We're not specifically speaking about the peer certification statewide. We're drawing on some findings from a needs assessment that was conducted within LA County Department of Mental Health around readiness for peers in working with LA County to pursue certification. And one of the findings addressed the value of supervision. So that's our focus today. And we're talking about, we are claiming that supervision matters and wanting to present it from a peer's perspective.
Deborah, I'm sorry, can I just give some housekeeping notes 1 second?
Of course.
I don't want to let you go too far in. I just want to let everyone here know that this meeting is being recorded. And I just wanted to introduce Deborah and Eric. So Eric has worked in the mental health field for the past 20 years and served as supervisor at LACDMH Peer Resource Center for 2.5 years. Deborah Pitts is an associate professor at the USC Chan Division of Occupational Science and Occupational Therapy. She has practiced, consulted, published, and taught in the area of mental health practice with a focus on psychiatric rehabilitation for over 40 years. Towards the end of this presentation, I will be adding in the chat a evaluation for this presentation specific to this hour. Please look out for that in the chat about 10 minutes before the end of the presentation. Sorry to interrupt, Deborah.
No,
you can go ahead and go.
Not a problem. Thank you, Dasha. Appreciate that. So again, we wanted to sort of address peer perspective, and we've already been introduced. We do want to acknowledge, and I apologize for the misspelling of Lori's name, but we want to acknowledge Laura Kerr, who was our colleague that was scheduled to present. She's unable to be here today, and her presence is missed, given that this is about her support needs as a peer. So it's a huge absence in our presentation, and we do apologize for that. We will try to share her perspective, and that included, but acknowledge that it will be limited because it's not her speaking. Also, we wanted to acknowledge Kumar Menon, who is with LA County Department of Mental Health Peer Services, who encouraged us to share our perspectives today. So the origin of this was that LA County Department of Mental Health was interested in determining how ready the peers that were already working with the department to pursue certification as it was being rolled out here in California. And it's a part of their ongoing commitment to building a strong practice and career opportunities for peer support specialists. It was a part of that effort. The department contracted with my department at USC, the Chan Division of Occupational Science and Occupational Therapy. I served as the project lead for the interview for the needs assessment. We developed an interview guide in consultation with an internal advisory group with the department. We then recruited and completed 42 interviews with peer staff and WOW volunteers, wellness volunteers. And then the team, our Chan team, analyzed the interview findings, shared those with the work group, and finalized a report. And the report has been submitted to the department and is available from the department if you're interested in reviewing it. You need to contact Kumar or Eric. What we found when we were doing these interviews is that there was a need for the department to continue to engage in the development in an ongoing way of creating a space of welcome and support within LA County Department of Health for peer staff to thrive. And that included the key role of supervision. The peers acknowledged that supervision was an important piece of that, their success as peers. We did recommend that at the conclusion of this, that the department needed to identify peer support specialist supervisor exemplars, because it was clear in our findings that not every peer had a supervisor that supported their capacity to thrive as a peer support specialist. So it was important that if those that did exist in the department, if the department could identify those, they might be able to share their approaches and their thoughts and their perspective on how they did that, and increase the likelihood that all peer staff would have a supportive supervisor. Eric is one of those folks that was identified as an exemplar, so he'll be sharing his perspective. The other recommendation was the importance of building a cadre of peer support specialists who can serve themselves as supervisors, as this has been identified as a key feature of SB 803 as well. Some of the perspectives that evolved out of the interviews that we did was that there was this sense that some supervisors got it and some supervisors didn't get it, meaning they got what it meant to work as a peer support specialist. They understood that that peer support specialist was a different kind of provider than all non-peer providers. Something very different. Their role is different. The practice challenges that they experience are different. How they utilize their lived experience is a very unique feature of that practice, of their practice, and that it was important that the peer support specialist, and this is some information from a VA study that looked at how to, and document that emphasized not creating many therapists or junior clinicians, that instead the peer support's lived experience allows the peer support specialist to fulfill a very specific role in the recovery process. They also noted that a supervisor who got it also could mediate the experience of peers when they didn't feel like they were being heard. Again, apologies for the typo. When multiple voices of professionals are in the dialogue. So there was this sense that when the peers are on a team, they are often the only peer or one or two peers. And so when they're the only peer and everyone else is a professional or a credential, has certain kinds of other types of credentials, that sometimes the peer feels silenced, that there isn't an acknowledgement of the unique lens. And but a good supervisor would actually elicit and ensure that the team was open to hearing and was regularly engaging the peer support specialist in their perspective, in their knowledge around any of the practice dilemmas that emerged in that setting. Also, as we already noted, it was clear from our peer interviews that there was a real interest in ensuring that supervisors that are available have experience, so that this notion that the people that are supervising need to be people like us, this idea that peers need to be supervising peers. And of course, this did come up in the DHS listening sessions around SB 803 as well. Other qualities of good supervision was that the peers noted that they felt a supervisor was good when the peer didn't always have to bring up their concerns, that the supervisor understood that there were these unique experiences and they actually elicited from the peer and asked the peer about those kinds of things. So that in their supervision and in their dialogue, the peer didn't have to be wholly accountable for sharing all of their experiences, but that the supervisor actually was eliciting that as well. They also appreciated that supervisors didn't direct them to do something, but help them explore what they might choose to do in their role as a peer, consistent with their lived experience in that situation. So a reflective, problem-solving approach to supervision rather than a directive approach to supervision. They also did appreciate that the supervisor when a supervisor was a good teacher. They appreciated some of their very specific practices that they have to engage in as a peer when they're a billable provider, for example, sort of how to write notes to meet documentation requirements, how to do things that are sort of not just specific to the role as peer, but are their responsibility as a provider within the Department of Mental Health itself. So they acknowledge that when the supervisor really helped them understand that was important to them as well. And we already mentioned this, that we did recommend that the exemplars be identified. So that's sort of a quick overview of the findings related to supervision with the needs assessment. There were other findings in the needs assessment, but with regards to supervision. So I'll turn it over to Eric and he'll share his perspective as a exemplar supervisor.
Hello, everybody. Thank you for stating that I'm an exemplar, but I'm not quite sure about that. Thank you so much, Dr. Pitts, for that nice introduction. I have been part of the Peer Resource Center at the LA County Department of Mental Health in Service Area 4, and we are going to be celebrating our 5th birthday this coming May, because May is the Mental Health Month. At the same time, that's when our PRC began, the month that we began. So anyway, I have been there for about 3 years, and Lori, who was our co-presenter, although she's not available today, I've been working with her for about 3 years now as well. And I would like to just share some of the struggles and some of the experiences and stories that I grew within as a supervisor and also as a friend and colleague to our 6 peer professionals. Their official titles are community health worker, but they are all with their lived experience. So when I first came as a supervisor to this peer resource center, first thing that I noticed was that I wasn't really quite sure what peer support was. So I'm open to it. I'm more than happy to just acknowledge that at the time, I did not have a good understanding of peer support. I just had some ideas about it. And then later on, when I received all the trainings, I realized that I came with a lot of assumptions of my own. So at the same time, as I was attending some trainings with other supervisors on the peer support issues, and then also as I was sharing some of the struggles with other program people who have peer professional in their team, everybody had this question: what is peer support? What are they supposed to do? So people had those kind of questions, but it was really hard to come to, I guess, a sense to like what that was. So the first thing that I would like to emphasize, if we want to work as supervisors for the peer work professionals, I think the number one, I guess, the focus that we need to have is we need to come to a common understanding, a good common understanding of what peer support is. So the first question that I would like to ask all aspiring is, have you been trained? Have you attended the trainings? Have you gained a good understanding of the peer support? And some of the training that I attended over time was that intentional peer support, honest, open, and proud training, wellness, a recovery action plan. And I attended International Association of Peer Supporters, INAPS conferences. And I know that there are many different peer certification training provided within the LA County. So all those things have been really awesome and really helped me to come to a realization what peer support was. At the same time, as a supervisor, I realized that I didn't have a good understanding of peer support also, but then at the same time, some of the people, professionals who are working as a peer professional, at times, they do not also have a good understanding of what peer support, the principles of peer support were. So I just want to stress that whether you're a supervisor or whether you are just a peer professional, just having a lived experience does not mean that you know how to exercise peer support principles. Yes, having a lived experience is valuable because that is a really key to providing the connection that the community is in need of. But at the same time, we all need to understand how to utilize that lived experience effectively at workplace as a professional to provide a help for the community who's in need of our services. So I just want to stress that we have to have a good understanding of peer support. So I'm a strong advocate for all these trainings that are out there that is helping us to understand what peer support is. And the second thing is, it doesn't matter if you receive a training, it doesn't really matter how many trainings or conferences you attended. It really comes down to if you really support this peer support principle, something that you are willing to implement, something that you are willing to practice in your workplace. So a lot of time I feel like in terms of hiring peer professionals, we are hiring, let's say we have a baseball team and we are hiring a lot of pitchers and with the promise that we will use them for pitching purpose, but we end up just making them play as a third baseman. So yes, we are playing a game of baseball and they are all interconnected, but the expectation they had when they're coming into the team was they're going to play as a pitcher. But we just utilize them as a just third baseman or some other field positions. So there's a little bit of that, something is not really well aligned, the expectations, the vision, the actual work that they do. So as a, not just as an individual supervisor, but as an organization, I think if we are saying that we will hire people with lived experience and we will actively utilize their lived experiences, then I think we have to make ourselves accountable to that promise and commitment. So I think once again, at the individual level and an organizational level, the commitment that we want to implement and utilize this principle of peer support is very important, because a lot of supervisors, first of all, they lack that understanding. And at the same time, therefore, they lack the commitment to implement that. So a lot of peer professionals, they get hired, but if you really look at what they actually do, really has very little to do with their utilizing their lived experiences. Oftentimes, they'll just do the same work as case workers. Not that these works are not valuable, but these are very important functions within the department, but we hire them as a peer professionals. We are supposed to use their lived experience, but somehow they're just utilized as a medical case worker, community health worker, and many different positions that really anybody can just do without having lived experience. So that's something that I would like to point out. And next slide, please. Thank you, Dr. Pitt. And then another thing is, one of the things that I got from attending all this training was that how the making connection is one of the most important strength and focus of the peer support is really about. So we are basically cultivating these professionals whose priority is making connection with the people who are going through their own recovery journey. So, I mean, if we are, as a supervisor, asking our supervisees to go out to the community to make connection, somehow or in some ways, the supervisors, we need to somehow demonstrate that with the people that we are working with, including our own staff. So basically, we are working with a professional whose priority is building connection with others. And then the challenge that I received was how much connection am I demonstrating with my staff at my workplace? So that was really like important for me. And I think Lori was going to discuss about this a little bit later on, but that's where the importance of the individual and group supervision plays. It plays such a great role in building this connection and demonstrating that you care about making connection with people, and you demonstrate through your own peer professionals that you are supervising. So just understand, already at the organizational level, the peers are being hired with the intention to make connection, utilizing their lived experience versus, just traditional system where they have a different worldview about how the treatment should be provided. There's already two different worldview coming in, same team in the workplace. And as a supervisor, my role was, how do we reconcile? How do we disagree respectfully? Or how do we try to understand each other's different approach to the same problem or different worldview? And how do we make them coexist and utilize each other's strength rather than just shutting one down? So basically like demonstrating that was really one of the challenges that I had to go through, and I'll explain that a little bit more. And valuing and putting focus on the peer professional strength, I think this is very important also. To be honest, some of the peer professionals who came on board in the team they need a lot more training and improvement in their basic work skills, like computer skills to public speech, documentations, writing, and all these kind of basic skills that is required for the work. But at the end of the day, as a peer supervisor, I had to make a decision, what is my focus? What is the goal and priority for peer resource center? Once again, it's making connection, using the lived experience to be the bridge between the available community resources and the people who are out there searching for help, right? So instead of focusing on these problems or the challenges, which are basically, I consider them as more of a mechanical problem, which can be fixed. All you need is some time and training and support. So instead of just focusing on or delaying making connection because of this mechanical problem, which will be able to be resolved with given time, we decided, well, you know what, we will work on that. But we want that those things are not going to be our number one priorities or focus at this moment. Although we will be working on them, we are going to emphasize your strength. We are going to run with your strength. And as a supervisor, my job will be providing support in that area. So that's something that kind of like it's more of an attitude of a supervisor, that I'm not going to penalize you so much for not knowing in a certain area, but I'm going to really focus on and encourage you to utilize your strength, your lived experience. And so anyway, as a supervisor, we will have to, at the end of the day, we have to decide what we will value and what we'll utilize more. And so I want to encourage all the supervisors, don't get discouraged by some of the lack of knowledge or professional training or skills that the peer professional may come in with, because if you invest time with them, they will be able to learn and grow. So at this point, at the Peer Resource Center, all our staff, they are very proficient with all those Microsoft programs, and they are running their online support groups freely. They know how to share screen, all this Zoom and Microsoft Team, this different kind of platform. It just took a few months for all of us to get used to. So those are mechanical skills, once again, we can learn. But lived experience is not something that you can learn over a month. So these are the year-long of struggles and journeys that needs to be cherished and honored. So for me, okay, you don't know how to run an online support group using Microsoft Teams or Zoom. Let's get to the training, because you will be able to learn within 3 weeks or 4 weeks, and I will continue to provide that support. But your lived experience is not something that I can train you. Your lived experience is not something that can be acquired in a matter of like three or 4 months. So I will put my value in that and I'll run with it. So I think that's some of the emphasis that I would like to make for an encouragement that I would like to give to peer supervisors who's going to be supervising peer professionals. Next slide, please. Thank you. And this is supposed to be Lori's part. So she was supposed to, I guess when we were preparing this discussion, I asked her, hey, Lori, would you please discuss what really helped you to thrive as a peer professional at the Peer Resource Center? So point out things that I have done well, but at the same time, please point out things that really impeded your growth and your ability to serve as a peer professional. And I was hoping to listen to that, the other part, what discouraged you, what can I improve? But I guess like I'll have to hear from her individually later on. But then anyway, she mentioned that building connection with peer professional was really crucial for her, because as Dr. Pitt mentioned from her finding, that many of the peer professionals, they are coming in to the workplace, and oftentimes they are isolated, or they cannot find many of their own within the organization, because this peer implementation and peer workforce and peer support, these are somewhat of a new idea within our department too. So oftentimes they feel it's hard for them to find their own support and people who are on board with their own. I'm sorry, I'm looking at the chat, some of the questions. I'm sorry, I'll answer all the questions later on. But basically, when people are coming on, they feel very isolated. Therefore, they're struggling, and they're also always wondering, you know what? I'm here to do peer support, but is my team supporting that idea? Is my supervisor supporting that idea? How about my colleague? Do they even know what peer support is? So for all those reasons, they feel isolated and they feel unsupported. So as a supervisor, it is very important to establish that connection through individual and group supervision. So first thing that I did when I came in was, first I checked if there has been any individual supervision established with all staff. And I saw that there was a little bit of a weakness there. So what ended up happening was, every week I decided to spend 45 minutes to an hour with each peer staff. We had a 5 peer staff at the time. So every week I will meet with them individually. And because I believe in the fact that if you want to build connection is organic thing. So you cannot just grow it mechanically. Human beings, we're living people. So if you want to grow a tree, you can give water and then nutrition all you want, but all day long and all night long, but you still need to wait for a certain time to see any growth, right? So I see the connection and relationship as that way. So I had to just spend time with them. So that was one of the reasons, not to micromanage or just to point out what they're doing wrong, or just to learn, what they have been doing. I mean, those are all important things, but most important thing that I saw was that they feel isolated in the workplace, and they felt somewhat unsupported by their own authorities. So I thought they needed to be changed. So that was the motivation behind starting that individual supervision on a weekly basis. And with all different kind of work on the plate, it was kind of hard to manage that. But I had to just prioritize it, because without building connection with my peer professionals, I thought it was going to be impossible for Peer Resource Center to do better. So well, yeah, one thing was that the individual supervision. At the same time, I brought my desk down to the peer resource center. I start just sitting there all day long, making myself accessible to all peer professionals. So throughout the day, they had access to me whenever they had any questions, whenever they needed any support. And at this point, in addition to that, we had individual supervision and group supervision. So the link between supervision and job satisfaction is whether it's a peer setting or it's just any other professional setting, the success and then the satisfaction, job satisfaction is really, it has a lot of linkage and relationship with whether you have a good relationship with your supervisor, whether you feel connected with your supervisor, and so that has been well proved. And the job satisfaction is I'm sorry. So anyway,
Go ahead, Eric. I just was, I'm aware of time.
Oh,
so
okay.
I was wanting to,
Gotcha. Thank you. Thank you, Dr. Pitt. Yeah. So anyway, it's still really important for us to really, I mean, the motto that I go by is, they don't really care about how much you know until they care about how much you care. So I think that the peer supervisor, if we can practice that and demonstrate that in our work setting with our peer professionals, it'll be really helpful. And at the same time, we have a different worldview. As I'm by discipline, I'm a MFT clinician, and I'm coming from traditional mental health service model. Although I work in different kind of a rehab and wellness center and peer driven activities and movement over some years, still, I'm coming from a different worldview than peer support. So how can I ensure that I understand what peer support is and who they are and what they're trying to do without spending time with them through individual and group supervisions and the encounters on a daily basis. So that's really important. And we have to identify areas for growth and setting professional goals. So they come in, and I mean, to be honest, in some sense, I was part of the wellness outreach worker, which is a DMH volunteer programs. And in that, the volunteer, when we are sending out the volunteers to different clinics, there's a little bit of a rule that they cannot be doing documentation. They cannot be doing filing. So we have to put some limitation on what they cannot do. And sometimes the people are asking the question, why do they put those kind of limitations? They can do many different things. We would like to utilize them more. And we have to put that kind of like a protection clause in the volunteer service. Why? Because we want to make sure that they are utilized, their lived experiences utilized at the clinic. Because because oftentimes what we notice, for whatever reason, they will be, their work, their lived experience somehow, because the people do not know how to implement that strength in their work field, or sometimes they just don't have that kind of authentic focus and commitment for it. For whatever reason there might be, we often find them being utilized in a corner, just doing work that has nothing to do with dealing with the people, using their lived experience. So I think, so one of the things that we have to emphasize at that their clinic and then our peer center was to make sure that we utilize their lived experience and implement that in our practices. And at the same time, we need to have a conversation with them. I had to have a conversation with them. What are your strengths? What do you want to do? In the supervision, any kind of like a regular encounter, the main conversation was not about what you cannot do, but it was more about what do you want to do as a peer? How do you see yourself as a peer professional utilizing your lived experiences? So our team of members, they brought many different ideas. Some peer professionals, they said, I know what is it like to be out in the street, living in a car, navigating through housing system. So I want to help people in that area. And we, like Lori, who was going to do the presentation today, she had such a big heart and passion towards supportive employment, helping people to find job and helping people to navigate through the entitlement under the benefit programs and so forth. And we have another peer supporter who is an artist and who is so into providing recreational and leisure-driven activities, because that's what really helped him to be on the journey of recovery. So through having these discussions, we were able to identify not only each professional's strengths, but at the same time their desire and passion to function as a peer professional. So it really kind of worked out in the peer resource center that we asked them to run with their strength, and when we did that, they were more open to bring what's happening, the fruits that they're bearing on the field, back to the supervisor openly. And I didn't have to micromanage or go into each places trying to find out what they're doing right and wrong. And so our group supervision became very living, vivid place where people will bring in their stories about stories that happened when they were trying to implement their strengths in the field and seeking consultation from each other. So I mean, there has been a lot of changes that we went through, and yeah, that's about it for our peer resource center. I just wanted to share that.
Thank you. Thanks, Eric. I do think that Lori's comments did line up with the needs assessment well, and we do apologize that she wasn't able to join us. And as we shared at the beginning, it would have been important to be able to hear, because we wanted to share a balance of perspectives, but I think it did line up. So we're open to questions. There were some questions that showed up in the chat, but some of those got answered. So if you'd like to add any things to clarify or any additional questions, please do so. Just unmute and speak. Kate, thank you. Yeah, go ahead, Kate.
I don't understand how the Department of Mental Health could have a peer services center that isn't run by a peer and someone who's never attended a peer support specialist training, which tells what peer services should be about. I'm shocked.
Kate, I just want to clarify. We are definitely heading toward that direction. For example, I'm just mentioning where we have started. Once again, Peer Resource Center, we are having 5th year birthday. So it has been always evolving and developing into true peer entity. So I would like to assure you that our Peer Resource Center, we are having a new peer, all these supervising positions to all this peer resource center will be truly peer driven. I'm very confident that we're heading toward that direction. But then meanwhile, we just had to kind of hold down to the fort and we're trying to work things out. But with the peer implementation, we are hiring peer supervisors and we are hiring more peer professionals. And we're trying to preserve the integrity and then the fidelity of the peer support model within the department. So we are heading to that direction. I can confidently tell you that.
Yeah, thank you, Kate. It's an important question and critique. Anna had a question. Do you feel that line staff is accepting of peer support specialist? In the needs assessment, today we just focused on supervision, but in the needs assessment interviews that we conducted, there was also a sense that colleagues, non-peer provider colleagues who are not in supervisory roles, but are working as colleagues to peers, also needed to get it. And that there was this clear clarification of what that meant. And I think Eric tried to capture some of that in his initial comments around why it's important to understand what peer support is and what that looks like. But that there was a sense that across the board, that the department had a ways to go in ensuring that all peer, non-peer providers, whether they're supervisors or colleagues, get it. And that getting it it was just so clear that from the peers, and we had peers in the needs assessment, we had peers who'd been in their positions for well over 20 years and some who had less than a year or so. So we had a real range in the level of experience working as a peer in the department. Thank you, Anna, for your question. Any other questions or comments? I mean, they can just be, appreciate the comments in the chat, but if you'd like to.
Hi, my name is Carolina, and
Hi,
I am
Carolina.
I'm the founder and executive director of a recovery community organization, the Happier Life Project, and we are peer-led and peer-ran RCO. Thank you so much for the presentation. I did lose connectivity there for a little bit, but I really find this topic super interesting because when I came into this with SB 803 and through some grant funding with DHCS, it was to expand the peer workforce and also for peer-run organizations to be able to find a way to become sustainable in providing peer support services, which meant to me in the community, right? Not attached to an agency or not attached to the county, but as a standalone, which I thought was great because I see that happening in other parts of the United States for quite some time. It's been going on. And I follow this really closely because I've been doing peer work for many years before it was ever called peer support work or even recognized. But there was places where they started, you know, there was peers that were already doing the work, but they got some training and then they were supervised by somebody else in another state that had already implemented this service. And then they let them out to be able to supervise in different areas throughout the state. Granted, they're not as big as California, but then they made it very clear, like Arkansas is a great model, North Dakota is a great model. Peers were the only ones supervising peers. That's it. And there was two separate ones. It is, you know, the mental health peers were separate from the substance use peers. And
Right.
Substance use peers are being part of community with these RCOs that are not, again, attached to the treatment, the capacity, because it's a very different role.
Yeah.
Like I've had my own peer coach through a substance use program, right? I'm a person with lived experience and I went through that and I had a peer, totally different role than when I reached out to another recovery community organization that was offering peer support. I still have her, you know, in a completely different, you know, but it makes it hard right now because here we are now with no clinicians on staff, right? With SB 803, you know, going in and it's like, okay, well, clinicians are supervising peers and it feels like the peer role is kind of just being just used in whatever way that is not even, it's not even maximizing the ability of the peer. I don't know. It's a hard one to watch.
I appreciate your perspective, Caroline. I think that this is not unique to California. It's not unique to the system. It's a global issue in the use of peers and how can non-peer providers get it? And a huge number of non-peer providers don't get it. It takes peers to continue to push and challenge and say to us, look, can you know, this is what it looks like, this is what it is. I must acknowledge that in the needs assessment, because our interviewees were already employees, we focused on employees of the Department of Mental Health in Los Angeles. Few of them were supervised by supervisors who identified as peers because they were identified as clinicians. And so this question of which hat do you have, where do you know, if you're dual trained, right? So if you're both a peer professional and a licensed provider, where do you stand on that? And what hat do you wear at what point? And that's a whole nother question. And it's not for this one. It's not for this one, but I appreciate your point. Thank you.
Yeah, thank you.
Thanks, Carolina. Appreciate it. We are at 10:59, so I'm assuming, Dasha, that we need to stop. Thank you so much for all of your being here. The needs assessment report, you can contact Kumar Manan or the department, and they would have to determine if they can provide you with a copy. I believe it's in the public domain at this point, but we were just the persons who produced it, but it's owned by the department. So you would have to get it from them. Thank you again.
Thank you, Dr. Pitts and Eric. Thank you. That was a great presentation. You want to check out the chat. I just put the evaluation in. And if anyone has any questions or lingering questions they have for Dr. Pitts and Eric, please put them in the chat.
And
Otherwise, I'm sorry.
I
go ahead,
should
Frida.
have said in the beginning, please refer to me as Deborah. I
Okay,
appreciate
Deborah.
acknowledging that credential, but there are too many people in this room that have credentials, and so thank you. But
Thank you. With that, we are going on a 15-minute break before the next set of presentations at 11:30. I'm sorry, at 11:15.
Dasha, do you have a copy?
Actually, it's
of the-
11:30. It's 11:30. I'm sorry, we're 15 minutes early. Go ahead.
Do you have a copy of the evaluation?
Yes, I put it in the chat a
Okay.
few times.
And this session actually goes for another 15 minutes.
Yes, that's what did you want to add anything, Ruth?
I'm just saying that I don't know if people want to discuss,
Oh, yeah.
or if the presenters want to take part in a discussion. I think the results of the needs assessment are really quite informative. And one of the things that I want to say is that the University of Texas has done a study on getting organizations to accept peer workers that's in print, and the different things that made a difference to how people, that had significant differences on how people accepted peer services, were things such as understanding what peer services are and what the evidence base of them is. And maybe I'm putting a plug in for my presentation this afternoon at 1:30 on 5 evidence-based practices in peer services, and also learning how to be an ally in teaching supervisors how to be an ally in to the peers in the organization, so that the misconceptions, discrimination, stigma, etc., get mitigated. And so, and there's a presentation on that. I don't know when that one is, but there's a presentation on how to be an ally as well coming up. So that might be of interest to people as well.
Vera, I see your hand up. Did you have a comment? Vera Calloway? Well, you might need to unmute yourself.
I realized, I did the survey. Anyways, thank you so much for your presentation. That was really, really wonderful. I think the issue of having peers as supervisors is something that, California has to work really hard to kind of just insist on creating avenues. And actually, I hope that there are in attendance today peer specialists who are not supervisors. I don't really know if you guys have any statistics on that, Libby, but it would be great, because the more information you have, the better it is. And I have to applaud the USC School of Occupational Therapy, because I actually became a supervisor not long after attending a program that they had funding for, which helped peer specialists in developing their own career path. I mean, we're all peer specialists in Los Angeles County, but there was no system where peers could kind of look and realize their own career ladder and realize their potential. And the occupational therapist that I worked with was really incredible in terms of helping me define my goals and what it is that I would like as a peer specialist who wants to develop her career. And so I really have to applaud the School of Occupational Therapy, and also, share, I don't know how many peer specialists are attending this, but the key to becoming a supervisor is to kind of be able to have your mind expanded to the point where you realize you can become a supervisor, that there is a career path. And we don't really have a career path in California for peer specialists who want to do more. The County of Los Angeles, I believe you guys have 500 WOW workers, some of who've been working for about, up to 5 years or a very long time. But I don't know that there's even a career path for them to become employed by the county Department of Mental Health. So there's a lot of work to be done. But this was an incredible session, this session, and on top of the first session, I applaud you guys at SHARE for putting together this conference. And thank you very much. It was really informative.
If I may, for the Department of Mental Health, at the Peer Resource Center and other programs, I know that there's a career path that is being developed. So the community health worker item is currently what we are, based on my own personal experience, there's a community health worker, that position that is being open, has been open for many people with lived experience. And there is also supervising peer positions available as well in the department. And the Peer Resource Center is moving forward in selecting peer supervisors with lived experience, supervising all the peer staff at the center as well. So those are the things and career ladders that department is working on, as far as I know.
I could just add on top of that, that the issue of a community health worker versus a peer specialist at Department of Mental Health is very interesting to me, because there will be state certification of community health workers. And so there is also state certification of peer specialists. So what if you're a community health worker who is a peer specialist? Are you going to have to be doubly certified, and who's going to pay for that? So that's just a question that I've been putting out for a number of months.
Luis Ramirez II.
Hi, this question is for Eric also. I'm a clinical supervisor for legal entity at the Service Area 1 at LA County. And we have this innovation too that's now used to start with a peer support. Now we call them Community Ambassador Network. I know Dr. Sharon changed it to Community Ambassador Network. So my question to Eric, so we have this supervisory community lead or peer support that will be supervising normal peer support specialists. Do they carry a caseload, Eric, in your system or in your organization? The supervising, we call it CAN leads or peer support lead. Do they carry also a caseload in order to deal with participants in the community?
Well, it wouldn't be right for me to comment on how other programs are, because I think the carrying caseload will depend which program you are working for. But at least for Peer Resource Center, until now, we haven't had any caseload requirement, because we are basically a program that is open to all community members. So anyone can walk into the Peer Resource Center, and our goal is to serve everyone who comes through the door, and providing various kind of community resources and connections to those. So far, no. I mean, there is a certain way that we document the help that we provided to show that the peer support and then peer resource center is effective.
Yeah.
But in terms of a caseload at the peer resource center, we haven't had caseload so far.
Yeah. So we are in the process of integrating also our peer support to our state medical contract also, so they could conduct and provide, and they could be considered provider also in providing rehab for in support of the old medical treatment model. I know Dr. Sherin is much more on the recovery model. That's why he integrated all this peer support, and I know he's leaving also, and will that more sure that's going to continue, and it seems like it, and I know the state is following through with that. And yeah, so how's that work? Do you call them community health worker as you transition them in your medical providing, something like that, or do you still consider them as peer support as the title designation?
Well, that's completely kind of like a out of my pay grade question.
Okay.
So
Okay.
job title and things like that. So I'm sorry that I don't have the answer for it. Yeah, but I think the peer resource center, I think it has been easier for me because this is a designated place where we are supposed to run with peer support. So I think having that organization's blessing and support to do a certain way is important. And one thing that, if I may, it's like, I think when I was taking the peer support training, there was one thing that people are saying it's about social change and culture change. And in the beginning, I couldn't really understand what that was, but now I kind of get it, because it is a movement. It's a change of attitude and culture, even within a system too. So yeah, it will go through it will require a lot of changes moving forward. And thank you for the question.
Thank you so much, panel also.
Kate, do you want to ask your question?
I just want to endorse what you said earlier about the presentation coming up on the evidence-based practices of peer support services. I've seen the material. It's really excellent. And Eric, it underlines in clear language, easy to understand, what you were saying about peer supporters as pitchers. What is the role of pitchers instead of other people on the team? So I wanted to ask you, Ruth, what time was that? Isn't it 1?
That's at 1:30. I want to get, is it Willita? Question in as well. Why don't you go, Willita?
So I wanted to comment on, I think it was Luis was asking regarding about the role of traditional health workers and peer supports. So I'm from Portland, Oregon. And so we navigate that same situation. We have peer supports and we have traditional health workers, which are the same thing. And basically it's a billing process basically regarding about our traditional health workers. And so that's how basically the title of that is, but basically it is the same role and you carry the same concept. I'm a trainer for IPS, for intentional peer support. So I support peers on that and we talk about that daily. So basically that's where the traditional health worker stand came from because it's a billing piece.
Thank you, Ms. Ross.
You're welcome, thank you.